Hey y'all, my informative speech is on sensory processing disorder. Sensory processing disorder affects about 1 out of 20 children. My son Finn is 8 years old, and around the age of 3, he was diagnosed with sensory processing disorder. It is a disorder that affects the senses. Sounds are too loud, smells are too strong, and they feel too much. It's basically their senses are overstimulated all the time. Oftentimes, though, sensory processing disorder is misdiagnosed as autism. Some of the signs and symptoms to look for in a child that may have sensory processing disorder are withdrawing from light and unwanted touch. In my house, we actually have room darkening curtains because the light coming in through the windows can sometimes be an overstimulant for my son. The unwanted touch is a lot of children diagnosed with this don't like to be hugged or hands held or things like that, because it basically makes their skin crawl when they're touched, and it's not a wanted touch. Gagging or refusal of certain foods. My son has a lot of food aversions. In order to get him to try a new food, he has to first smell it, then he has to touch it, and then he has to take a small bite and try it. And I would say 9 out of 10 times trying a new food ends up just bad for us. He gags, sometimes makes himself sick. There are times where I can't cook certain foods because he has an aversion to it. With his sensory processing disorder, I can't have the mindset that a lot of parents have of you'll eat what I make, because he physically cannot eat what I make. I have to stick to foods that he likes, that I know he likes, and we just have to be really patient with that. It's heartbreaking to see a child gagging because they're trying something new. Another sign is dislike of teeth brushing and hair washing. Oftentimes the sensation of the toothbrush in their mouth makes them gag, so parents have to literally hold their kids down to brush their teeth. Hair washing is a big issue in our house. It's better now, but when he was a baby and a toddler, bath time was terrible. The sensation of the water around him, and then on top of that, trying to pour water over his head to wash his hair was just not good. It took 2 of us to wash his hair. Now he's old enough he can wash his own hair, but even that is still a bit of a struggle, so we have to work on that too. Another one is avoidance of messy textures and lotions on their hands. Finn cannot have dirty or sticky hands since he was a baby. If anything got on his hands that was sticky or dirty or messy or even like a lotion, we have to wash his hands immediately, wipe them off and wash them. He just can't handle it. The sensation of something being on his hands just makes him crazy. And most kids that have sensory processing disorder, I feel, have this aversion to sticky, messy stuff like that. With a little boy, it's hard too because he's all boy and he gets messy and he gets dirty, but I just have to make sure that we have things on hand to wipe off the yuck if needed. Otherwise it can throw him into a panic attack or an anxiety attack often. Another one is strong preference of certain types of clothing. For my son, he cannot wear denim. He won't wear denim. He cannot wear button-up shirts that go up to his neck. So getting him to wear a tie for First Communion, I had to bribe him. And he would only wear the tie long enough until Mass was over. And he only wants to wear sports clothes, so things like basketball shorts, running pants, Under Armour. He does like the compression shirts, and often sensory processing disorder children like compression clothes. For Finn, he tells me it feels like he's getting a squeeze, which a squeeze is when I have to hug him and hold him tight when he's having an anxiety attack. So him saying that about compression shirts, we buy a lot of Under Armour compression shirts because how adorable is that he thinks he feels like he's getting a squeeze all day. So that's kind of cute, but it's hard that he can't wear just anything. We have to be really particular, even shoes. He is having anxiety right now because we have to go shoe shopping for the school year, And what he has, he's comfortable in and he's okay with, but they're wearing out. So we have to get new shoes, and that's a tough task for him. Oversensitivity to stimulant and visual stimulants. I wouldn't say he so much has an overstimulant reaction to visual stuff. He actually kind of is drawn to it. Things like the iPad and video games and stuff like that calm his mind. It's the only time he told me that his brain stops thinking. So, but he also has ADHD too, so he's got kind of a double whammy against him. There are two different types of sensory processing disorder children. There's the seeker and the avoider. A seeker is somebody that constantly needs the stimulant. They need to spin, they need to run, they need to jump, they need to hop, they need to feel, they need to do things in their control and constantly be stimulated. But a seeker can get overstimulated. So Finn is a seeker. He's always jumping and running and going, but I have to be careful with a parent on setting his limits as far as what he can seek out. He can get very overstimulated, and once he gets overstimulated, he shuts down. He starts to have anxiety, so I have to watch for those cues with him. The avoider avoids stimulants. They are very calm, collective, withdrawn. Those are often the ones that are the children that are misdiagnosed as having autism because they're not super social. They're not outgoing. The overstimulants freak them out. They don't handle it very well. Some of the treatment options are physical therapy, visual therapy, listening therapy, and psychotherapy and speech therapy. One of the things that we've opted to do is occupational therapy / physical therapy with Finn. This introduces him, it's like an immersion therapy. They, in a controlled environment on his time, almost make him do things that he's uncomfortable with, things like swinging, touching things, smelling things, stuff like that, to get him out of that mindset that he can't do these things. And it's really helped a lot. We've noticed a lot of difference since he started doing the therapy. One of the main points I wanted to make is that often sensory processing disorder is misdiagnosed as autism. When I first took Finn in, his doctor wanted to diagnose him as being on the spectrum. But I just knew as a parent that that wasn't right, that wasn't his diagnosis, that wasn't the problem. And I had to do some of my own research. Finn is very social. He's very outgoing. He has a lot of friends. He makes eye contact. He has things that are different from autism. Autistic children, however, typically do have sensory processing disorder because those two do go hand in hand. But just because a child has sensory processing disorder does not mean they are autistic. So that's something I have to constantly fight with his teachers to, not fight, but inform his teachers about too, is that he's not autistic. He's not on the spectrum. He has something completely different from autism. And it just has to be treated differently. And a lot of people don't know about sensory processing disorder, nor have they heard about it. And when 1 out of 20 children are affected, it's likely that you have a child in your life that has this disorder and either hasn't been diagnosed or has been misdiagnosed. And so my plea to you is, if you see a child that is just different or quirky, treat them with kindness, treat them with patience, and understand that if they're having a meltdown, that it's something the parents can't control, it's something the child can't control, and just be compassionate, just be good people. That's all I got for you. Thank you.